Well, let's call this meeting to order here. It's about 4 minutes after 11 here. And we'll start with some introductions. We'll start with Crystal.
Crystal Kennedy, Suzanne LaFrance.
Keith Peterson.
John Weddleton.
And on the phone?
Felix Rivera.
Okay, fantastic. We have several members that are traveling right now, and so that's obviously why they aren't here today. So let's go to our first item under new business. It's Mom and Pop's Grocery Liquor Store compliance with the conditions. And who do we have that's going to be making the first report? Here comes our Assembly Attorney. Mr. Gates is here.
Yes, thank you.
Did you want to make a report on what you found, or?
Sure, why not? For the record, my name is Tim Potter, representing the Midtown Community Council. And at your last assembly meeting, I did report to you and give you a package of information concerning the lack of compliance or non-compliance of Mom and Pop's grocery and liquor. I have talked to the owner and let them know that I was going to be bringing this forward and that they'd been out of compliance. And it was the community council's intent to request that the assembly either act now to revoke or repeal the conditional use that was granted, and or short of that, I know Mr. Peterson, you had indicated that at the appearance request a question, and that was, when does this license come up for renewal? And it is a 2019, and it is on the list now and will be coming forward. So in either way, I have some desire to have you go after the conditional use permit to send a strong message to the rest of the operators in the city that in fact the assembly is watching and is willing to take action if promises are not kept. I do, however, understand that with the workload and everything else that it may be more timely and easier for everyone to address it in the renewal request, and that you simply go forward acknowledging that they have been non-compliant. We've got a significant amount of evidence that shows that they've been non-compliant on multiple items and issues, and that you formally let them know that they are likely not going to get their renewal for all of these reasons. They had their opportunity last time. They've had 2 years. They've failed miserably. We were hopeful that the memorandum of understanding and the conditions that were on the conditional use would have taken care of the issue. For several months, they were compliant and have now not been for probably at least 6 months, possibly longer, because we did take their word on several items. And now, as I indicated at my appearance request presentation, I even question that now as to whether or not they've been in compliance much at all over the last year and a half. Thank you.
Thank you. And so, do you have a question, Mr. Weddle?
Yeah, I guess Danny would have answered it. I thought the liquor licenses came up every 2 years. Is that right? Because it says
yes,
we dealt with it 1 year ago.
It's up for renewal, and it's on the list, which I did receive from Ms. Honest, and I believe that it is at its 2-year renewal time, coming up at this fall.
Well, this, what we have here, dated June 12th, 18, says it's for renewal.
I would ask for clarification from the clerk's office.
So they kind of are delayed. So it was a 17-18 liquor license previously, and so at the end of 18 was when we got the license for the previous year. So there had been some issues with it, with the receiving of the application. It came in later in the renewal period than some of the other ones, and so it delayed when we saw it.
And so the renewal is due before the end of the year for 20 and 21, is that correct?
Correct.
Okay.
Can I ask
Follow up.
I guess the obvious questions then is, so if we protest, we have two things: protest a license to AMCO or deal with the special land use permit. So if we protest the license, we've done that before, but does that ever stick? I mean, what do we say? Because they didn't follow special restrictions put only on them, we protested. How's that look to AMCO? Anyway, I don't know.
Through the chair. So because the ABC board implemented those conditions on the license as requested, there is a provision in state statutes that allows for the local governing body to protest or to notify the board that they are not abiding by the conditions placed on their license. I have not seen, in the time I've worked or in the history that I've looked at, a protest based off of that, but my understanding would be because they found the conditions not arbitrary, capricious, or unreasonable and placed them on the license, it would be a viable protest to the non-renewal of the license.
So if it's not renewed, what happens to the license? They're just out there, whatever it costs, a couple $100,000 worth of license?
I don't know what the status would be. It would not be renewed. I don't know from a legal state standpoint if they would still have something that they could attempt to transfer and sell to someone else. But quite frankly, personally and on behalf of the community council, non-compliance should not be rewarded in any way, shape, or form, in our opinion. Whether they lose money on it or not, none of the items were pecuniary in nature at any significant basis, and they were not arbitrary and capricious. It is our hope and desire that coming back through the assembly, that a larger sub-district of the city will have an imposition of similar conditions, because we are having problems all over town with the same product.
So it seems like we, as a body, have got to decide whether we're going to pull the conditional use permit or pass it off to the state and see what they do. I myself think that, since it's a local license and the community council has worked out a memorandum of agreement with them and they haven't followed it, that I think if we are going to, protest the license, we should go ahead and talk about seriously pulling the conditional use permit. And that's just my opinion.
Mr. Chairman.
When we have done this in the past for a license in Mr. Constant's district, that business did close down, and eventually they were able to sell that permit to someone else a year or so later. I don't believe they lose the entire value of the license, as I recall.
And as far as the decision as to go after the conditional use permit and ask for and recommend a non-renewal on that basis to AMCO, I'd ask you to seek counsel and also work with Ms. Miranda on us to determine the best path. But it may be most appropriate to take both actions so that AMCO understands that this operator will not have and does not have a conditional use in order to operate a package liquor store, which is a requirement in Title 21.
And we could also say that if they are allowed to sell that permit, it has to be at a different location. It couldn't be just sell it to someone else and open back up at this same current location. Do you have something to add, Ms. Thomas?
Through the chair, I was gonna say that for the license, if the assembly chooses to protest it, full-on protest the renewal without any conditions allowing for, remedies, typically the board has been doing the 60-day abeyance. But the applicant also has the opportunity to appeal that decision. So there is a time period between where they will have the opportunity to kind of work out whether the license will actually die or not. And the board has, it doesn't happen very often, but the board has brought back in that case, and I believe there was a lot of go-between with the municipality and the applicant and the state at that point to allow that license to come back and be transferred. So I don't know that that's a typical thing that the board does, is bring back dead licenses, but they have in the past.
Okay. Did you have any questions, Ms. France?
I had put myself in the queue earlier, thank you, Mr. Chair, and mostly because I wanted to check with Ms. Honest as to the time frame and our options. So, just so I'm clear, we can hold a conditional use permit, and then we can also protest the license and recommend non-renewal. Though we probably would want to consider including conditions to remedy that situation, or would we, if we want to go there, or how do we?
That is up to the discretion of the assembly.
Okay.
But yes, you would have the opportunity at any time to pull their conditional use permit, because that is a municipal permit, so that's totally under your control. Timeline is on your grounds. The license protest would be potentially anywhere between like November and March. It's dependent upon when the applicant submits their renewal application and the state sends it to us. But that would be another opportunity or a second option along with the conditional use, as Mr. Potter said.
Right.
The other option is at any time the local governing body can notify the board that they are not in compliance with the conditions. And then, as you said, if the assembly chooses to protest conditionally and add extra conditions, that is an option, but that's up to the discretion of the members.
Okay. How, and may I follow up? So to notify the board, does that take the form of a resolution then from the body? Or do we just ask you to do that or work with Mr. Gates?
I think I would defer to Mr. Gates, but I believe it would probably best be as an AR, as kind of a guidance to the clerk's office, and collecting some of the facts and findings that they have not followed these conditions, and here's the facts and findings of that.
So, Mr. Gates, do we need to do an AR then if we're going to protest this?
Or notify the board?
Or notify the board?
You need some simple action, and the simple action takes the form of a resolution or an ordinance, generally. Or a vote, but you would want this all documented well in writing, so you have good record to send to the ABC board. The findings of that, based on evidence presented, perhaps we can give some numbers, things like that.
Okay, thank you. Well, is anyone here from Mom and Pops? Were they notified that this was going on? I get the feeling they don't take this very seriously.
I don't know if they were alerted to this. They did know that I was going as an appearance request. And I understand that counsel that represented them before is no longer involved. And I'll just leave it at that.
I think you're correct.
There's reasons.
Ms. France?
I know Mr. Reynolds also has his hand up. So just so I'm clear on the sequence of actions, so Mr. Gates, you go ahead and put a resolution together so that we can notify the board that they're not in compliance, and then a separate piece of that might be a discussion as to whether or not we pull the conditional use permit. What do we have to do that piece, the conditional use permit?
I think it's three-part question, isn't it? So I think that if we're going to do this as part of the renewal process, Ms. Honest, there's our template of our renewal resolution. It can include there our protest based on facts. If we were going to do it under the other subsection about notifying the board of an operator being out of compliance at any time, and we would do that by resolution as well, in separate process. We have the renewal period coming up, so I guess if there's a real sense of urgency to do it sooner rather than later, you go that route. But if I think the renewal process is coming soon, that would be my preference. For the conditional use permit, this isn't something that we see used very often. It would be more complicated, I think. We don't have a regular standard process for revoking conditional use permit. We do have procedures in code to do so. We would start, I think, by communicating to the planning department that we want to start a revocation process. And then they would review that, they bring to us what we asked for, a resolution that's then a report about the conditions of the property and how it's used as good. And for us to look at revoking the conditional use permit, it's a very adjudicatory sort of process. So, did you have anything else to add? And I would also note, I think that perhaps maybe the owner has arrived.
Right, I see that someone has come in. Are you here from Mom and Pop?
Yeah. Or myself. Yes.
Okay. Well, we just had a report from Mr. Potter from the Community Council, and he's presented some pictures and evidence that you haven't been in compliance with your conditional use permit, and so.
And then sit down somewhere. Oh, okay. Oh.
Can you sit down? Sure. Right over there, be fine.
So, I mean, when we first started this, when we met you guys last year, we did this. You know, I thought everyone was gonna get this, and not just my store. You know, and every time I do come to like the community meeting, yeah, I miss like a lot. But I know I thought all the local business who owns liquor stores that are around me would like come to and like talk about it. But I feel like I'm like the only one who's getting attacked by this. You know, like marking up my shooters, like I'm still more than anyone else around me. And you know, someone could just literally walk 30 steps, not even a minute, there's a liquor store right in front of me, then in that one. And it's, you know, when someone comes in my store saying, oh, why is your price higher than everyone else? And, you know, I gotta tell them the reason, and she'll just leave and go somewhere else, you know. But, you know, owning a business, you don't want to hear that. It's frustrating. So, you know, to get some customers back, we did give like 15% discount or something. I should have marked it, but it's, you know, it's not fair that my store is, you know, just getting attacked by this, which everyone else aren't like agreeing with anything with me. And I'm the only one who's willing to like step up, do this in a way, or actually pick up trash, or do something. I just don't think it's fair.
Can you say your name for the record, sir?
Yeah, my name's Edward Lee.
Okay. Well, we have been considering coming up with some sort of policy that would encompass the entire Midtown area, so that everyone would follow those same rules. All that has not been come to fruition yet.
You know, I still haven't gotten like a straight answer if like they even asked the other stores or you know what they said. You know, like what about the other stores? Like what did they say about it? like, why can't they change their price if I, you know, like, agreed to do something?
Mr. Potter, has the community council approached some of the other
To
operators?
respond, yes, we have, and you're aware that we also testified on the in-and-out transfer here recently, and we had discussions with them. I believe that now they're selling, and they'll be transferring that liquor license or attempting to. We have talked to the new Safeway store, and I've actually toured some of their other operations, and they've enacted similar limitations as far as the pricing and product at their stores within the Midtown area, and so the Gamble store in downtown, as well as the Carp Aurora out on Westmoreland Light. I visited their Muldoon operation to learn a little bit more about some of the things that they do to protect their operation and review purchasers and how they manage theft and of not just alcohol but other items in the store. And that would be something that maybe it would be very interesting with the police and this group of assembly members to see at least the amount of data that they manage on a daily basis to be able to manage, monitor trends and things that are happening in the marketplace, including products that are used to cover the taste and smell of even folks drinking hand sanitizer with high alcohol content. When they see a spike in the sale or theft of Mio, which is an additive for color and taste, you can tell something else is happening within the kind of the social strata and atmosphere of the marketplace. So we have, and in reviewing the list of all the 2019 licenses that will be coming up for review, I went through that list yesterday. We had a executive committee meeting of the Midtown Community Council, and we will be requesting, because that's our opportunity until we can get some of their ordinance adopted as a sub-district or the entire city. The only way that we can deal with this, and we issued our frustration with that originally, that it's only when they come up for renewal or transfer that we as a community council have an opportunity to try and influence anything as far as the conditional use for the license. So we will be doing that. Mom and Pops is up, and there is I believe a Brown Jug, and the Walmart in Midtown are all coming up for renewal, and we will be commenting specifically about those licenses.
Okay, thank you. Mr. Willington?
Well, yeah, I appreciate the position you're in where you have special restrictions. But, so what would it take for you to kind of follow these restrictions that were put on you?
I mean, if everyone just played what I'm doing, you know, like, I stepped up and agreed to it, and, you know, and everything, which I, you know, feel like I didn't have to because other people aren't, like, stepping up or nothing. I mean, I just want everyone to be fair.
So when you say everyone, I mean, In-N-Out's right around the corner from you, or there?
I mean, there's In-N-Out, there's even Brown Jug, like, not too far. I mean, I know there's Walmart too. There's at least 4 that's within, like, 3 miles, 4 miles from me. And I'm still at the highest price. I haven't changed my cans, and I was supposed to do that too, and now it's just specifically about shooters in this thing, in this case.
Can I follow up? So, so I guess you did agree to it. So we had an ordinance or a resolution that asked the alcohol, the state, to add to your license these requirements, and I understood they did that. So you are kind of bound to follow these,
Yeah, well,
whether they're fair or
I
not,
thought
right?
everyone would do it with me. You know? But when I like check prices on everyone's or all the prices, they're still the same like this past whole year. So I'm just, you know, it's kind of frustrating just to see, you know, like what's around me and I'm like the only one. I'm losing customers too, which is kind of, you know, sucks.
Mr. Chair, can you put me in the queue, please?
Go ahead, Mr. Rivera.
Thank you, Mr. Chair. I don't mean to be harsh by these comments, but frankly, I am not happy with the answers that you are giving us. We have given you an opportunity to abide by these conditions. The Midtown Community Council has worked with you in good faith to abide by these conditions, and yet you have failed to do so. So what can you tell us now to convince us that you will change your act and that you will abide by these conditions, regardless if it's fair or not?
If I still have the conditions, or like, definitely follow it now. I mean, yeah. I just don't think it's fair, like, at all.
Anything else, Mr. Rivera?
Yeah, thank you, Mr. Chair. So I would suggest that we stick with our original intent here, which was to send to AMCO a notice that the licensee is not following its conditions,
I mean,
and that we move forward with a review of the conditional use.
So,
Okay, Mr.
so,
Reed?
so are you guys trying to like shut me down now, like, just because of the shooters?
Sounds like it's a possibility.
I mean, my whole license is gone.
This is a serious situation.
Yeah, I know it is, and I mean, I don't think that's right to do that to me. It's not fair just to, you know, do it. You know, I try to make a point and prove this town, like, you know, we do have a homeless problem, you know, but, you know, just singling me out and no one else is saying, doing nothing, doesn't make any sense. Like I was willing to step up and change the price. I mean, my prices were still the same, even though my workers sold it for $1.50 instead of $1.70, just to give them like a discount just to come back, you know. We only selected a couple. I just feel like it's not fair. It's not right. When I'm willing to like change something in the community and about the homeless people. I mean, I feel like it's not right. It's not. Our prices are still higher than everyone else's, you know.
Well, we're in the process of
Is there any
increase,
way?
trying to get conditional use permits for the other operators in your area as well. So, I mean, if the plan comes to fruition, we'll have similar pricing at all of these, at least 4 of these stores in that area, so that you know, they won't be able to walk from one store to the next to buy something that, you know, that might be, you know, 20 or 30 or 40 cents cheaper or whatever. But, you know, you already have the conditional use and you agreed to these conditions, and so you're bound by them.
I only violated one of them, which was the shooters.
Is that correct, Mr. Potter?
That was like the only one.
The pricing of the shooters, the sale of more than 2 per person per day, marking the shooters with a distinguishing mark so that we could determine whether or not all of the shooter bottles being littered in and around the property or up and down the street were from mom and pops or in and out.
Yeah, that's the one thing. Like, how are you guys gonna blame all the trash when there's so many trash around there, all throughout the streets, and not just that area? You know, there's
response to that,
there's trash everywhere. Like,
in response to that, Mr. Chairman, if Mr. Lee would understand that marking the shooters is as much for his own benefit as anything else to distinguish whether or not it is his customers that are throwing them out 2 steps out the door or around the corner or up and down the street, or if they were in fact coming from a different operator. If they were coming from a different operator, then that makes it very clear that he is not the problem, he's part of the solution. And right now, after the last 4 to 6 months of monitoring their sales and seeing that they have been non-compliant on multiple issues and conditions, including not marking at point of sale and time of sale, it's extremely frustrating to us to have not a solution to a problem, but a continuation of a problem.
Ms. Friends.
Thank you, Mr. Chair. To the operator, thank you for being here. And you know, we've heard that you don't feel like this is fair. However, as has been pointed out, this is where we're at. These are the conditions you have. And to go back to Mr. Rivera's point about what are you going to do to show us that you intend to follow this memorandum of understanding. And so, for example, number 4, more than 2 shooter bottles of hard liquor have been sold to the same person in one day.
Yeah.
Okay. And the chair spoke of that one at the last meeting. You know that has happened. Are you going to provide training to your employees?
Yes,
Do you have signage posted? Are you, unsure how to enact these, or what's your plan for putting these conditions in place to ensure that you are following them?
I mean, yeah, definitely put signs, definitely train my workers a lot better to, there's multiple ideas I can do for my store for these rules. Like I said, putting a sign up and everything too is a really good idea.
And just to follow up, because, again, I hear you that you don't think this is fair, but this is not the time to have that part of the conversation.
Yeah.
I mean, the focus is on what are you going to do in your day-to-day business practices to ensure, the MOU is followed. I mean, that's how you build trust, because I'm in that same place. I think there's a pattern.
Yeah.
And it doesn't sound like the intention has been there. And I agree. I think, as a matter of fact and findings,
I've been,
it hasn't been followed.
okay, personally, I've been marking shooters, and my workers, they're just being lazy at that time. They're not doing it, following the rules. Because I know, for a fact, I didn't sell hard. He came in, but I definitely train my workers a lot better. But I just thought everyone would get this MOU thing too. I didn't really know what an MOU was before I even agreed to it too, and now I realize it's like a serious thing to follow.
Didn't you have counsel, didn't you have a lawyer hired at that time? Didn't he explain to you what an MOU was?
Agreement?
Yeah.
Just agreement, things to follow. No, but I really thought everyone would get this. And I just got frustrated that no one got it for the past year. And just, I was just trying to help some of my customers out, get some back, because, like I said, hearing a customer come in saying, "Why is your price is higher than everyone else's?" and they just leave. It's just really frustrating to be a business owner, But
Mr. Walton?
I mean, if you guys give me another chance with this MOU thing, I can prove to you I'll definitely make it up.
So when are the In-N-Out and the Close Brown Jug licenses? Do you know, Tim?
In-N-Out came in for their transfer. I've spoken to the new owner and licensee, which is Eunice, so it's the original owner's daughter, and her mother. And they have listed the business for sale, and they are attempting to sell the license as well. And we went on the record at the assembly meeting that we were not going to oppose that transfer. We understood it was a health-related thing because her father had a very serious medical condition and is still in an extended care facility, making slow progress. So they will be getting out of the business, and we ask that they acknowledge to whoever the new buyer might be that we want them to have an interface with the community council because we will be seeking cooperation with these same conditions.
So if the license is transferred, does it still have the same expiration date? So do you know when that would be? Because that would be the next opportunity.
Theirs is expiring at the end of 2020.
Correct.
So another year, so we got quite a length of time. And then the brown jug that's nearby. Which brown jug is that? I'm trying to think. Is that the one off of Spinard?
Actually, I believe it's the one on Old Sword.
Those were, those are too.
Well, if there's going to be a transfer take place, we could add the condition use changes when the transfer takes place. Is that correct?
Did that already happen, or there? That didn't happen.
Through the chair, with the In-N-Out license, the board did not uphold the request of the assembly to impose conditions. So the transfer that was before the assembly, if they sell that, you will see another transfer once they sell the business and the license, and would have the opportunity to request conditions be placed on the new owner and operator at that time with that transfer.
So why did they not impose the conditions on In-N-Out? I mean, the situation is parallel to what we see at Mom and Pop's. So they put the conditions on Mom and Pop's.
They found the request to be arbitrary, capricious, and unreasonable due to the timeline. The assembly passed a resolution that protested the license pending a continued public hearing, I believe, and final action on the license. And my understanding from the AMCO office is the board didn't see reason to uphold the protest because there was no facts and findings with that protest, and so they renewed the license.
So we bobbled the presentation would be kind of the issue. I guess if I could make a point is we are generally committed to imposing the same conditions on operations in the area for the same reasons that we did in your case. We just haven't had a total success.
Because they didn't agree to anything like I did. You know? They just said it was arbitrary, which, yeah, I guess. I mean, I could have said that too. Which I kind of feel like I am in that boat too.
Mr. Gates?
Thank you. I was just going to mention what Ms. Honest stated at the end of what she just said. We had asked for a conditional protest until we held a public hearing so we can get evidence from the public, but they denied that because we didn't have actual evidence, just requesting that we delay a little longer for the public hearings.
So we have got some time to find additional evidence. Maybe the community council would be looking for some of that, and so before the transfer, or an application for transfer comes before us. But if we had additional information the next time, we might be able to put those conditional use items on there.
Mr. Chair, you know, I believe that the evidence was there. It was that a box was not checked and they did not have information in the file. The information was available, and I can't explain exactly why, but it was an effort, and the community council has been pretty clear that in our attempts, and I'm still working with council to get a resolution and an ordinance to you that would, and I've been going to the other community council meetings to try and get about a 7 community council area that would have imposition of similar conditions, because the products that are being sold for the prices they're being sold for are having a significant impact on the city from a variety of different aspects. I'm personally committed, community council is committed, and unfortunately, we're stuck in a situation that we indicated originally that the only way that we can approach this without an area-wide or a sub-area district created is to go to the operators and effectively try to get either by force or not compliance with conditions when they come up for renewal or there's a transfer. That's just the way the system is set up. And it's actually been nice to see since the code got clarified that the assembly of the city takes their conditional use process for alcohol package and sales as seriously as they do.
Okay. All righty. Any other questions about this particular item? You have Mr. Gates?
I don't have questions, but I wanted to mention that through the license period of 2 years, there is a process where you could protest the continued operation after the first year or for the second year. So that's not for mom and pops, but for in and out. I guess they were renewed last spring, and we could do protest the continued operation and not sit on those conditions. It's not a process I've really seen, but it's in the statute for licenses and so forth. But if I may, I would also I'd like to ask Mr. Potter a question. So Mr. Luzier said that other operators don't have these conditions, and he's mentioned In and Out and Brown Jug. But from the community council's perspective, are there other liquor stores in this area that should have these conditions as well? Just In and Out mom and pops.
There are 11 to 13 licenses within the area that we have identified in a concentration in 7 community councils. Most of them are in Spenard and Midtown. But even going out to the Brown Jug at Tudor and Elmore, in the old Teenage Village Shopping Center, I have photos that would hopefully surprise you during spring breakup, and it was not an effect of having been hidden by snow. I went in and talked to the salesperson and asked if they had issues with selling shooters or some of the fortified beers, and you know, it was, oh no, we don't have any trouble at all. And you walk outside and there were no less than 16 empty shooter bottles on the walkway around the building that store is in, and there were 6 cans of beer that were empty in the landscaping island directly adjacent to the front door. The staff literally had to walk over bottles and cans, and if that's not an expression of an attitude that as soon as something leaves the doorway is no longer our concern, it was pretty pathetic. And yes, that one will be one of them that I hope to bring into compliance as well.
All right, thank you. you have any last thing to say, Mr. Lee, before we move on to the next item on our agenda?
I mean, is there any way, like, to prove to you guys, like keep this going for my store for like another couple months or something? Or I really don't want to lose my license for just the same. I want to actually like prove the point too.
Well, if you follow the conditional use agreement that you signed with the community council, there's still a possibility you might be able to get your license renewed. But it's going to be up to you, because they're going to be watching you.
I don't think. Carter's seen me deny someone too, and literally go to, in and out, buy a lot of shooters, and just litter my property. I mean, what about
Absolutely.
what
There's
about that?
nobody in town more frustrated about what happened with In-N-Out Liquor than me and the community council, because we indicated that we were going to try and pursue the same thing. We met with the owner. He complied with the fortified beer, and the pricing did not with the shooters. And even after his medical condition changed, they continued to sell shooters for as low as 99 cents a bottle. We tried. I think that we lived up to our end of it. I don't know exactly why the box was not checked on the materials that went to the AMCO board. But, we are pursuing, and we testified on the transfer of ownership and put it on the record that we will be following that one and want to work with the new party, whoever gets transferred to. So we're working within the legal rights that we have, Mr. Lee, and I think that we have been, and I feel personally frustrated by you in having gone out and looked at empty shooter bottles in the landscaping area by the end of your building and seeing that none of them were marked, and saying, well, that's pretty obvious that none of them are marked, so they're not your problem. And then finding out through additional purchases on that to see that in fact your employees, possibly not you, but your employees were not marking at point of sale. And that leads me to believe that there's a strong possibility that of the dozen or so bottles that you and I picked up one day in the landscaping area and the sidewalk that did not have any marks were likely sold from your store.
Some of them I didn't even sell in my store.
Okay.
So
good point. And some of them you do. And I'm just frustrated that you entered into an agreement, you gave your word, and then we have to find out by virtue of keeping an eye on it and actually making purchases from your store that it's not being complied with. And as I told you when I spoke to you recently, when everything else is stripped away, the only thing you have in life is your work. And if that's no good, then it's no good.
Okay, but
so I think the assembly has suggested to you that you come to compliance and you come forward with a plan on how you're going to improve your compliance, be in compliance, and be a good neighbor and a good operator. The onus is on you. I helped before. I'm not helping anyone.
all right. I mean,
Okay. Thank you, Mr. Potter. And Mr. Lee, I think you know the situation.
so what goes on from here for me? Like, at my store, what happens?
Well, if I were you, I'd be training my employees to follow all the rules or the requirements in your conditional use permit. I'd be serious about it. I'd be there every single day because your license is in jeopardy at this point.
Okay, now I'm gonna have to definitely find new workers or fire someone else.
Mrs. Franz?
And I think, yes, come up with a plan and document every everything that you're doing, so you can show how you're complying and the efforts you're taking. I think that's very important.
Ms. Honest?
For clarification with in and out, the process that the municipality took wasn't different. We have in the past submitted a conditional protest that would allow the assembly to continue public hearing or to continue the review of the license, and in the past, the board has allowed that. So my understanding was in this case, they decided they weren't going to allow it. So it wasn't a process of the municipality on it. It was a decision of the board. So the process was the same.
Okay, well, thank you. And let's go to the next item on our agenda, which is our fire department has a core team report they'd like to give us.
Good afternoon. Have you had a chance to look at the report yet? Is it not ahead of time?
I just glanced
Or
at
did
it.
it just? Okay. So this is the 2019 annual report for the AFD core team. This is just kind of a summation of the past year. And the core team, which has been discussed in previous meetings, this stands for Community Outreach, Referral, and Education. And just a brief history, which it is covered in here, kind of the impetus behind the core team is this started off with one of our firefighter paramedics being assigned with Chief Dahl's community CIT team. So this was the MIT team, sorry. So this was a mobile integrated.
By the way, introduce yourself for the record.
Assistant Chief Eric Scheneman. So the MIT team was established in January 2018, and that was involving the CAP team as well as a licensed clinical social worker and also one of our firefighter paramedics. And so, excuse me, they initially just kind of focused on Brother Francis Beans Cafe, just looking at a little bit of working on education down there, just with the issues we were having 2 years ago with increased responses to public safety, something that could be done. Kind of what came out of the MIT was just some internal research and also data crunching to look at specifically what affected the fire departments the most. And Mike Riley, who was our firefighter paramedic, had come from a previous service. They used a concept called community paramedicine, and it's using emergency resources more in a public health and not so much social work, but more of a social manner as well. In emergency services, especially fire EMS, we typically have one place we can take patients, and that is to the emergency room. Well, Anchorage is unique in some ways in that we have a considerable amount of what we call high utilizers. And these are patients that we see not just once or twice a month, could be 50, 60, 70 times a year that we're interacting with them. And again, just our focus has been all that we can do for them is take an emergency department, which it's just a revolving door. Once they go to the emergency department, they're taking up a bed. They're probably going to be without within 30 minutes, and they'll be back on the streets or at a homeless shelter or even in their house and calling 911 again. So as part of our research, we focused on just how much of an impact the high utilizers were having with AFD specifically. But also, it was more of a needs assessment in that we looked at kind of all aspects of our annual call volume. The high utilizers, behavioral health, substance abuse, and as well as what's called low acuity, or not so much of a critical response, but low acuity requests to 911 were our top three. So the core team was kind of an impetus that came out of that to address these, hence the outreach, referral, and education. So, unfortunately, we just have one guy. Again, it's Mike Riley, who was just put TDY to work on this project. So for over the last year, what he was doing was identifying some of our high utilizers and enrolling them, kind of like a client. And he would work with them. He'd work with the APD APD CIT, Sergeant Adolph, if they had some behavioral health issues, as well as finding out who the social workers were, the case managers, working with the hospital staff, and just trying to find the best way to give these people the right care at the right time instead of just continuously taking them through that revolving door into the ED. So this would be something as simple as just assisting with getting the medications. So the person would go to the emergency department, wouldn't have care there, but the reason why they're going to the emergency department is they either didn't have the money or the transportation to pick up their medications. And it'd be the same way with their primary care providers, is if their doctor or PA wasn't available, well, they would just go to the ED. So kind of Mike would focus on this small group of high utilizers and get them with the right physician or the right physician's aide or nurse practitioner to be able to provide them more reliable care, and also work out ways to using taxi vouchers to take them there versus having to call an ambulance. So when you look at in terms of how this reduces cost of the healthcare system, it is pretty astounding. It doesn't so much save our budget because we still have not using an ambulance or a fire truck to provide that care. There's some a little bit of cost reductions in terms of fuel and supplies, but the bigger end and more long term is when you look at just like Medicaid and Medicare, not having to take these individuals to the emergency department all the time, those cost savings add up. And as you'll see in the report, it can be pretty substantial with even just a small number. But within our community, and we've identified, you'll see the numbers, and there are 100 plus individuals that we encounter more than 2 or 3 times. And there are some, like you'll see in top 5, that 20, 30, 40, 50 times a year we're responding on a 911 call to them.
Sometimes more than once a day for
sometimes several times a day. So part of the whole impetus for the core team is to bring kind of an alternate emergency response team to the table. And while we were here, for example, as Mike was meeting with clients, and he was also interacting with Chief Dahl's CIT officer, Sergeant Adolph. So just the fact that it's a multi-agency effort, and it takes more than one person. So that's why when you look at organizations that have community paramedic programs or mobile integrated healthcare teams, it's not just one individual. So we are kind of limited, as Mike is. He normally works on an ambulance or fire truck, so he is just on the TDY status. And over the past year, we've been trying to look for funding options. Teams typically are more grant funded, where they wind up, just redeploying resources that currently exist. But when you look at kind of long-term benefit to the community, as well as healthcare in general, these programs do have a success. Not immediate, but long-term, because they're just be able to provide that the right care at the right time.
So a question just came to mind. How do you determine whether an individual needs to go to the emergency or just needs to go to the sleep-off center? Or who makes that decision?
Well, so with the clients that the core team has enrolled, so to speak, these are ones we've identified through our data. So these are ones that are in our patient care reporting system or our fire reporting system. And so what Mike would do is the core team was actually go find them, reach out to them, actually sit down and spend some time with them, figure out what exactly is going on. Now, over the past year, there's been incidents on his clients where they've called 911, and if he's working, he's been able to respond and intervene. And instead of them going to the emergency department or going with APD, he's been able to channel them, focus them in another direction. So kind of when you talk like versus going to the safety center, that's a little bit more back into that 911 activation versus what Mike does. So the core team, again, is more looking at the long-term face of it and just trying to provide better care instead of just continuously just putting them in an ambulance and
set them up with services that they qualify for.
Yeah. And there's within the community, there's so many different nonprofits. It's actually pretty astounding when you sit down and try to figure out and navigate people into various social services and healthcare programs, just how big it is out there in the real world, and how difficult it is to get someone with chronic mental health or medical problems that right care versus just continuously taking it to the emergency department where it's when they're occupying a bed that's a more critical patient to probably utilize, and then they're just not getting the care there. So it's trying to break that cycle of repeated visiting, at least so similar to maybe like on the criminal side, we're looking at for the medical and healthcare side.
Ms. Kennedy.
Thank you. Yeah, this was actually a fascinating report, just in terms of what you've been able to do to try to figure out who really needs what. And I kind of feel bad that we have to do that. It's kind of like a triage going on when you've got a 911 call. You assume that when someone calls 911, it's really an emergency, but I don't know that that's really how people look at 911 anymore. They just look at it as whatever need they have at the moment, and somebody's got to come help them. So, but it's interesting that you've identified a certain number of high utilizers. So are these people who typically call in themselves, or is somebody calling in on their behalf?
A lot of these are actually themselves. So when you look at what we've kind of discovered is the majority of them, 53–54%, they actually have their own houses, so it's not like a homeless issue. But they're by themselves. They have no family. They have no resources, and when their safety net starts, shrinking, either it's due to loss of social services, loss of Medicaid, Medicare services, the last thing out there is calling 911. So we are, police and fire and EMS are kind of the last ditch hope for a lot of these people, and that's how, when you mention how 911 has shifted, and it has over the last 10, 20 years, it's, I need a glass of water because I can't reach it, I call 911. So there's been a societal change, and when you look at kind of the emphasis on we were always there for emergencies, heart attacks, fires, whatnot, it has shifted considerably to where it's anything under the sun we call 911 for. So this is trying to reverse that in a sense and find just better resources for those members of the community that don't have it and are utilizing police and fire.
Thank you. Yes. So in terms of identifying these callers, Annette, so is this something that dispatchers are aware of these people? I mean, is there some kind of a list that when you get a call from this person, they're a regular and they're going to need more specialized services, so they then look at the core team? They make that decision then to involve your group, or how does that work in terms of when that 911 call comes in?
So since we only have night, we're basically a Tuesday through Friday daytime. That does happen, especially with those that are housed that we're aware of. Depending on the extent of their condition, is it just a matter of navigating them to the right resources, or do they need a little bit extra special care? So we've actually developed some patient care plans, and we'll tie that to an address so our dispatchers are at least aware. So sometimes they are initiated through our dispatch, but again, most of the time it's just them doing outreach. And the crews over the last year or two, they'll start recognizing some of Mike's clients, and when they're interacting with them, they don't really have a lot of options other than the emergency department, but they'll provide that feedback to him so he can kind of loop back around and follow up with them when he is working.
Thank you. Mr. Cates.
Thank you. Yeah, Mr. Schuneman, I see that right. I see you had recommendations at the end of this report, and first was to increase staffing from 1 to 4. Do you know if that's thinking came to budgeting team?
I defer that to Chief Hetrick. I mean, it has been something we've been working on, is looking for grant funds over the past year, and unfortunately, a lot in public health, a lot of grants are usually funneled through the health departments, and they're not really available for fire and EMS services. But we work very closely with, of course, Anchorage Health Departments and as well as state health and social services. So we've had a lot of meetings to try to look for some funding options. Just not a lot out there right now.
I was just reading through the recommendations. I see another one that you said maybe requires some state level action to to address limitations with current scope of practice to allow community paramedics to begin providing limited primary care and point of care testing. Is this something that needs a state law change to allow that to happen?
Currently in Alaska, paramedics like myself, we're licensed under the state medical board, and so our scope of practice is in state regulations, and there is a limitation in there that paramedics are not allowed to do primary care. So primary care is more like what a doctor or a PA will provide. In states that have had some success with community paramedics, they've actually changed that legislation. So this is something that the EMS office at the state level is also aware, because they're looking at it more long terms, and not just for paramedics but for EMT2s to change the language, because it's not just an Anchorage thing, it's statewide, and to be able to allow EMTs and paramedics into the world of providing a little more primary care and become more integrated with the healthcare team. And it's especially important in the rural and bush areas as well, since some of their rescue squads may be the only health care they have, but they just can't provide that level of health care to the community.
Ms. LaFrance?
Thank you, Mr. Chair. So a follow-up to Mr. Gates' question. Do you know if other states where they've succeeded in changing the law have been able to access any Medicaid funding for this kind of primary care?
Minnesota is probably the best example. They've actually changed the law. They've not just changed the regulations for paramedics, they've created a community paramedic certification. And with Medicaid, Minnesota, and there's a couple other states now that have actually created a special Medicaid funding code. So that type of services can be charged to. And we've talked with our state health department about this as well. It's more of a long term, but they're aware. It's everything we do here, I've been feeding up to the state as well. So some states have had some success, but others not so much. It's just the whole concept of MIHCP, it's different in every community, is what it comes down to. So some communities, these physicians, these personnel may actually do home health care follow-ups with, say, like heart attack victims, stroke victims, where they're actually doing some in-home care post-release from the hospital. Others like us more focus on value utilizers, and even others are primarily focused on behavioral health and substance abuse. So it's kind of difficult to write one law for all, so to speak, but states have been trying to be a little unique in the way of legally allowing paramedics and EMTs to provide that service, as well as to charge for it.
So in the short term, would there be any advantage in just looking at the staffing recommendation from 1 to 4, if it was a team that included public health and nurse? I mean, because presumably then, under those different parameters of being able to practice, I mean, I don't know enough about, functionally, would all 4 of those people, when you say increase it from 1 to 4, would that be in several different vehicles or groups of 2? I mean, I don't know, maybe it's just an individual response.
Yeah, it just depends on how you lay it out. I mean, one we're looking at is 24/7 coverage, because when you have a single client, a lot of times when they go in a crisis, it may not be when the team's working. It could be late on a Saturday night or on a holiday. So having 24/7 availability is one part of it. 2 is having just a more diverse group, whether it's a licensed clinical social worker, public health nurses is one thing. The one thing a licensed clinical social worker gives is the ability to charge Medicaid as well. Nurses not so much, but qualified health professionals and LCSW can. And that's rather new with Medicaid up here too, which will allow that for behavioral health and substance abuse. But it's not something that we with paramedics at this point can bill for.
Thanks. Thank you, Mr. Chair.
So do you know, have there been any bills introduced to the Alaska legislature that would put in changes to allow something similar to what the state of Minnesota has done?
Not at this time, other than discussion and research.
That might be something the legislative committee could tackle and maybe make a recommendation to legislators to take a look at that, because this is not just an Anchorage problem, this is a statewide problem you mentioned, so it would help other jurisdictions as well.
Yeah, Juneau Juneau Fire Department just recently took over operation of their equivalent of Anchorage Safety Patrol Safety Center. So they're kind of looking at also expanding, but their emphasis is more on behavioral health and substance abuse versus high utilizers like us. But it is a catch-all. I mean, we all face the same issues.
Okay, great. Any other questions from members of the assembly? Do you have anything to add, Chief Hedrick?
Good afternoon, Jody Hedrick, Anchorage Fire Department. I would like to just touch on what Dean Gates brought up earlier. We have a proposal into the municipality administration to add a core team as an actual team, and it is a four-person team that would be on shift, hopefully 24/7. So basically, our proposal is we would have it's 16 people, which is a law enforcement officer, a firefighter paramedic, a community paramedic, a caseworker, and a behavioral health specialist, because we think those are the four components that we need to have working with these individuals. And we would hope that we would add 4 teams. So we would have one on duty at all times, one full team on duty at all times. That's a big lift, so we'd be going from a single person who's been doing this work and does a phenomenal job to teams of people who could actually address a much larger population. And our hope is that this would allow us to prevent people from dropping into homelessness and eventually get to the point where it really addresses our homeless problem. And that's our hope. This is the preventative side of our work to reduce our homeless problem. So we have proposed it, and actually for a couple of years, I will continue to say this the entire time that I am here, that one of the areas that Anchorage Fire Department could really do the best work to serve the community is by adding the core team, and we need the funding to do that.
Mr. Wilkie?
I mean, that's the thing, that's pretty expensive when you get there. But it says in here, you're saving some money. Part of the idea is, someone's saving some money. And here it's Boyd EMS Transport and Emergency Department charges of more than $450,000. So there's savings there, but is that $450,000 that you would have been billed for and you're not now?
No, actually, it's a combination of that's emergency room costs that the hospitals are bearing some of that cost, which then gets translated out to the greater community. It is a reduction in the use of police department time. It's a reduction in the use of fire department time. What it actually could do if we eliminate our transports for this group of the public, it would reduce our revenue. So that we would not be able to bill, those are patients that we're not going to transport, so we wouldn't be able to bill them. So technically it would reduce our revenue in one piece. However, the long-term cost to the community would be savings at the hospital, and we would be able to be available for work that is truly where we should be working, which are dire emergencies, people in cardiac arrest, people whose houses are on fire. These people do need services. They don't necessarily need emergency 911 services, and unfortunately there is no other place, no other group that is available to do this work.
Thank you.
Hopefully I answered.
Any other questions from the assembly on this issue?
Sorry.
Mr. Willis.
What kind of dollars are we talking?
This is a $4 million a year. That includes their computers, office space, uniforms. That is the full-in package. I think it's like 3.9 something, and we expect within 5 years that we'd be at that mark. It wouldn't start out that way at year one. Well, our thought process, we start with 2 teams operating on daytime hours, and then the next year we would add 2 more teams. So within 5 years we're talking, and it would include some cost of living expenses and stuff. Within about 5 years we expect it would be close to $4 million a year. We would start out slow on that.
And so do you you would have to train new teams, and it would take that long to sort of ramp up to get up to 4 full-time qualified teams.
Right. We would start, the first year would be building the team and making assignments, and the hiring process, of course, is going to take a while because, as you're aware, hiring within Alaska for social work positions and behavioral health specialists, it takes us a while to find the right people, so we know that would take some time. Chief Dahl and I have already discussed, it would be a patrol officer would probably be involved in this, so they have patrol officers available. However, then they would have to backfill the ones that would do other work. Same thing for us. Right now, this program costs us close to $400,000 a year to offer because we're using the firefighter Riley, whose time, so we're paying him his full salary, but that means that he is not available to do his regular work, so that's almost $200,000 in overtime he costs us every year. It's worth it. It's absolutely worth it to our organization just because it reduces calls, but the number one priority, it's the best thing to do for our community, and this help we're able to provide for these people, they're not going to get anywhere else.
Do you have anything to add, Mr. Dahl? Chief Dahl?
Thank you, Mr. Chair. I don't necessarily have anything to add to what Chief Hetrick said, and rarely am I in a position to improve on anything she says, so I won't try. But if I could have just a moment, Mr. Chair, I do have an introduction I'd like to make.
Sure.
Lieutenant Gina Burrington is APD's newest lieutenant. She was promoted yesterday to lieutenant, and Monday she will take over command of the community policing team from Lieutenant Carson. So I just wanted to introduce her here today. She's been with APD for 26 years. So she's been around a long time. I know she's going to be great, but because the community policing team interacts with this body so regularly, I just wanted to take a chance to introduce her here today.
Well, and so as long as we're talking about the CAP team, we are still having sort of tents popping up in parks all over town. I just actually have found numerous in a park near where I lived over the weekend. And so are we in a situation where we're able to tag these camps now? Is there availability at the shelter for individuals that are homeless?
I believe there is, and I believe that the CAP team is sort of in normal operating mode when it comes to posting and tagging camps. I don't know specifically what their activity level's been like the last week or two, but I don't think there's any restriction on what they're doing right now.
Okay.
If that answers your question.
All right. Yes. Thank you.
Yeah. Thanks.
Okay. Any other questions about the Court Fire Department team or about our CAP team leader? Mr. Wellington.
I bring something up, and I think part of this is stuff we've all known is going on for years, but we had a succinct and angry email recently. You were probably on it too. And the guy's just like, right behind my yard, there's a group of campers having a wild drunk party right now, and it's late at night. And I want that stopped. Like, 60 police shut down that park here, which was decent for campers. I want 60 descend on that at 2 a.m. and shut it down. And, I mean, we can't have that, but we don't do that. There may be reasons. How do we get so we can do something? I mean, can we shut down wild parties? If there's a house with a bunch of teenagers, you'll get on there, just swoop in, and you'll shut it down. How do we do it when it's in our parks?
Well, I mean, I think we do, and we do it the same way. And I don't know specifically about that incident. I haven't seen that email. I'll tell you just my experience is frequently when we see people that are I don't know, communicating in that way, my first question is always, did you call APD and tell us? And like very, very, very frequently the answer is, well, no, I didn't. And it's like, okay, well, I have a really hard time helping you if I don't know that the problem is happening. So that's always my first question. And with regards to a situation like that, if you have somebody that's creating a disturbance in the middle of the night, and it really doesn't matter where it is, whether it's in a park, whether it's in the apartment next to yours or whatever, that is something the police department can address. And if somebody, it doesn't matter if somebody's homeless or camping out because they choose to or whatever their status is, if they're creating a lot of noise and it's disturbing the rest of the world, like that's actually something we can fix pretty much on the spot. And that's something that patrol, we don't always have 60 people working at 2 o'clock in the morning. And if you want that many people working, like that's a whole nother discussion. But we have enough to deal with that problem, and we do. And that's a regular occurrence around town. And you ask any patrol officer going through a disturbance, especially on night shift like that, yeah, that's what they do. So, we provide warnings depending on the circumstances. Maybe we skip past the warning and take action right away, or we issue a warning to quiet down, we come back, people get arrested for disorderly conduct, which is a misdemeanor arrest and potentially something that you get remanded for.
So if I could, what are your, what would it look like if they're in the woods, they're off the Chester Creek Trail, and you can't really drive your cars there? How is that handled? Say there's 10 campers, it could be a long-standing camper, a new one, and they're all drunk. How do you deal with that? Do you have to send 20 cops?
It depends. It just depends on the call for service, and the officers typically are going to be somebody there is going to have experience with the area and kind of know what that looks like. And yeah, if it's something like that where they think there's a lot of people and they're going to have to dismount and walk into whatever the area is, they're probably going to take more than just 1 or 2 patrol officers to go address that. It just depends on the information they get when they get sent down there, or whatever they discover when they arrive.
Good, thank you.
And this really isn't homelessness committee, but we have been told, or I've been aware of several police chiefs have told us that we can't arrest our way out of the homeless problem. But I also have neighbors telling me, well, how come, if the park's closed at 11, how come we just can't go in and arrest these people for trespassing? And so it seems to be somewhat of a gray area, and I don't, obviously there must not be an easy answer, or we would have come up with it by now.
Yeah, I agree. If this was something that was easy to fix, we all would have solved it and moved on to something else. And that's clearly not the case. And it is frustrating because it seems like, oh, well, the park's posted 11, you're done. Like, that's it. You just enforce that law and it's all fixed. And unfortunately, as you all know, as lawmakers, a lot of times you enact a law and then there's a court at some point maybe modifies that law as it was after it was originally enacted, or comes out with an opinion that becomes new case law that then sort of instructs the government on how to act in those circumstances. And when we look at homelessness, like that's a lot of the issue that we're dealing with, right? It's not very clear-cut or straightforward. It's not something where you post a sign and it's done. There has been a tremendous amount of legislative action and judicial action on some of these issues. And so some of these things, while many of us have been involved in this discussion for a long time and maybe sort of have a grasp of what that looks like, it's really, really, really difficult for the public to see the problem and not, it's very hard to understand why it's not a clear-cut solution. And I totally get that frustration, and I think even for us sometimes it's not especially clear.
Mr. Wilton?
Well, I just want to point, we're well versed on the constraints for shutting down camps, but I think it's a little different when it's a party going on and it's not in the middle of the night. That was my point there. That's a behavior. Right. You don't have to be, that could have been high school kids, it could have been adults.
Doesn't matter what your status
is. People in their 60s,
right.
Their kids left home and they celebrated, but they're loud and rowdy and drunk when they shouldn't be.
That's kind of a different deal. Yeah.
Okay. Any other questions for the chief on behalf of Mayor Mr. Gates?
I would just like to add to what Chief Dahl said, arresting for trespass. I worked on this issue years ago in 2009, and at that time we were taking a policy shift towards campsite agreements rather than trying to arrest people for simple trespass. The real problem is arresting people for trespass. Like Chief Dahl said, doesn't really solve anything. It's a revolving door. We pick up, process them, take them to jail if you need time for arraignment. Within 24 hours, they're arraigned by court to pretty much released. So it's just a revolving door system that costs us taxpayers money to support that system. It doesn't have much of an effect on the overall problem. So just
plus it clogs up the court docket as well.
Okay, thanks.
So, all right, thank you. Any old business that anyone has that we wanted to bring up while we're here? We still got a couple minutes left here before our time's up. I don't see anything. I guess it's time for audience participation. Do we have anyone in the audience who would like to make comments? No comments from the audience? I guess I'll take a motion for adjournment.
Second.
We're adjourned.